All the babies that I love and have, Rida Bitters, like I said, is the Lord Commander. Rida Bitters is the boss, of the chain of commands of all the Rida products that I have used. And that's because it's been able to fight two of one of the biggest problems we have in Nigeria, Africa, and the world at large, which is hypertension and diabetes. And I'm going to give two testimonies of two very close patients to me that I've had to use the bitters for, and they worked. So I'm going to start with one interesting patient in my church. She is 57 years old. When she was handed over to me by a much senior consultant who told me, I said, look, Dr. Susan, we've done everything we think we can do for this woman, from insulins to OADs. OADs are oral anti-diabetic medications. And the sugar is just not coming down. As I speak with you, as she was telling me that day, her fasting sugar today is 492. I said, 400 and what? And she's walking, she's not in coma, she's talking. The only thing that was very visible with her was that she was having hand tremors. She said, doctor, leave, I've tried everything. In fact, I even want to die. It was that serious. And she said, if it's this diabetes that will kill me, let it just kill me once and for all. Let me go and join my husband. The husband passed on, barely 2 years ago. And she was frustrated, tired. I remember that day, she was looking so skinny, very lean. What a medicine would call someone looking wasted. She was looking very wasted, dehydrated, not nice at all, and was just done with the whole diabetes trouble. And so when they told me that, oh, Dr. Susan, we want you to handle her case, we have tried everything we can do, and I think you have something that will be of help to her. She said, oh yeah, she said, oh doctor, don't change my medications, I don't want medications. I don't want insulins, I'm tired of pricking myself. Anything that is not medications. I said, okay, I said, fine, you're going to be my good best friend. So I sat her down, and then I told her, I have this herbal medication. She was like, herbal, okay, yes, I was even told you're a herbal doctor. I said, yes, I'm Dr. Alagbo. Alagbo is a herbal person or a herbal seller in Yoruba language of Nigeria. So I said, yes, I'm a doctor of herbs, And so she said, give me everything, but nothing that is drug. I said, are you ready? She said she's ready. I said, are you willing? She said, as far as it can buy me time. And I asked her, how old are you? She said, 57. I said, you're just exactly my mother's mate. My mother clocked 57 this year. So I'm not going to buy you time, but I'm going to, by the grace of God, help you to be able to be here to carry plenty of grand and great-grandchildren. I said, by the way, how many grandchildren have you carried? She said, none. I said, and you want to die? I said, how many jeeps do you have? She laughed. She said she has a car. I said, me, I want to buy my mother plenty jeeps. I've not even started. And my mother cannot even go anywhere now. Go. So why would you now want to go? Because of diabetes. She now said, doctor, you don't know what I've been through, this and that. I said, I understand. I may not be the one wearing the shoe, but I have been around people who are wearing the shoes of diabetes, and I know what diabetes can do to somebody. But I have something that can help you, do you good, because I have used it for various people. I was very particular about her because of the way she was looking. I looked at her like my mom. My father has passed on for at least 27 years. My father passed on. So, and I know how my mom was looking at the time when my father passed on, and it wasn't fine. So I told her, I said, look, this is my own story and experience. So I'm going to take you like my mom. I'm not just going to treat you like my mom, but I'm going to treat you with the care that I've given to other diabetic patients with this medication. And let's see how we go from here. And I told her, I said, just give me 3 months. And if after 3 months it's not working, whatever you discuss with God, I'm game. And she was like, Dr. Susan, do you know what you're saying? I said, I'm very confident in what I'm saying. And we said, okay. So I told her, I said, okay, I would need 2 days to be able to reach out to get back to you with this medication. So in the meantime, do me a favor, take your metformin. Metformin is what's also called glucophage. It's the primary drug for diabetic patients. So I told her, take it today, That day was a Sunday in church. Take it on Monday. By Tuesday, I'll get back to you. And then take it on Tuesday. Tuesday evening, we would see. And so she said, she even you mood. I said, Mommy, you know why? I want us to have the recordings and the readings so that when the story chart starts changing, you'll be able to tell the difference and you'll be able to see what you have done. And so she said, okay. So by Tuesday, when we met, I brought my own Rida Bitters, the big one, and I gifted her. I said, look, this is my love gift to you. Just try it. And we started with 20 mils in the morning and 20 mils in the night. And the reason why I said as high as 20 mils was because of the level of her sugar. 492 is an alarming level of sugar. It's an alarming level of sugar because of the pancreas, because of other organs. A whole lot of people don't even get up to 300 and something and they're in coma. A lot of people don't even get up to 300 and they come in shock. So 400 and something is was quite alarming. So we started 20 mils in the morning, 20 mils in the night. And so after 1 week, our sugar level had hit 200 and is it 79 or 97, one of them, I can't remember now. And I was screaming because I expected to hit 200 after about 2-3 weeks. And she said, Dr. Susan, it's as if this your drug is working, sha. She said, I said, Mommy, you're not yet convinced. She said, no, because I've used other things. And when I use them, when the sugar crashes down like this, all of a sudden, it will go up again. And I told her, I said, okay, you know what we're going to do? We're going to stay on these bitters and we're going to modify your meals. She said, like, as far as I will not touch her biscuits, she likes sweet biscuits. I said, I'm going to touch it because we cannot have an injury and be treating the injury and still be pouring more injury on that same injury. And so we started working on her food, portion control, cut down on the carbohydrates, cut down on the things that she needed to cut down on. And I told her, I said, Mommy, we're just 1 week out of 3 months. So let's see what it's going to look like after 1 month. And then I placed her on the insulin. And I'm going to tell you why I had to do the insulin alongside. Because when the sugar level has hit that level, which means the pancreas is no longer, the insulin production is no longer sufficient. So we need to feed it back with insulin to be able to do its job. And so after much appeal and drag, she just started the insulin alongside the bitters only. She refused to take any other tablets. And I said, okay, it's fine. And so by the 3rd week, we were hitting sugar of 100 and something. And by 1 month, in fact, we had run into hypoglycemia. Hypo means hypoglycemia, low sugar level. The sugar level had come down to as low as 70. And I said, okay. It's time to tailor down, okay? So we streamlined our bitters from 20 mils morning and night to 10 mils morning and night. We are not up to 3 months. We are 2 months old now. As at 2 Sundays ago, she was just telling me, and Mama came giving me this, size of long fresh fish, smoked and barbecued, and just to say thank you. And she was telling me that, oh look, we're 2 months now, and I'm off the insulin. And she's no longer taking the insulin now, even as at yesterday. She is basically on her bitters, and our sugar level has not crossed 120. We are doing excellently well. Now, the good thing about the Rida Bitters is not just that it brings down the sugar level. It brings it down and maintains the sugar level after it has been brought down. So if you're dealing with diabetes of any kind, type 1 or type 2, yes, please go ahead with your doctor's prescription. Now, however, you still need to add the bitters to be able to keep it balanced. Because some of the time, most of the time actually, once the sugar level is down, once we take something that, stirs it up again, it flies all the way or skyrockets, But what the bitters does is that it doesn't just help you bring it down, it maintains it and helps it and prevents it from, going lower than it should be at the normal level. So I'm encouraging every one of us, for our parents, our siblings, our friends, our clerics, most of our pastors and imams that are diabetic. Diabetes kills, but diabetes can be prevented. Diabetes kills, and also diabetes can be prevented from killing. Those that are diabetic can live the optimal life that their creator has created them to be. So if not, why not? Just have one shot of the bitters, 10 mils every day, and keep your sugar level at its best and at its peak. The beauty of it is that it goes alongside with the high blood pressure drugs too. Once you take for those that are hypertensive, or those who are both hypertensive and also diabetic, the sweet thing about it is that it's bringing down your sugar level, it's bringing down the blood pressure. As the blood pressure wants to jump up, the bitters will just tell you, Oga, stay down. And that's why I call it the grandmaster, because it is the controller of every other factor that is happening in the bloodstream. So you take it, it keeps it at the pipe down and maintains it there. So even when you are taking your sugar level drugs, like for most of my patients who take their diabetic and antihypertensive drugs, we've had to tailor down the dose. Those who are on 10 milligram, we've tailored down to 5 milligrams. Some on 5 milligram, we've tailored down to 2.5. Some on 2.5, we have to tailor down to alternate day. In fact, I have two clients, precisely the ones that my head can remember now, that do not take their sugar level drugs every day. They now take once in a week. And that once in a week is because these two particular patients are the party type. They come from a family where there's always a party, or there's a weekend gyrating and stuff, all of that. So that weekend, they know that, okay, they've gone beyond their boundary. It's family food, and you can't exactly prevent people from cooking what they have to cook with all the spices and all. So when they do that, they take their sugar level drug and the hypertensive drug. And after that, they just stay on their bitters, and they are doing very, 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 very well. So I encourage doctors and nurses particularly, and pharmacists, please, while you are prescribing your OADs and OHAs, oral anti-diabetics and oral antihypertensives for your patients, please prescribe the Rida Bitters alongside. The good thing about it is it's capsulated and also comes in liquid. So if, for example, you say, oh no, I don't like bitter stuff in my mouth, I don't like liquid, you can always have the capsule. Or no, I don't like capsule, I take a lot of capsules, you can always do the liquid. We have anyone that is more convenient, most convenient for you. And as you take them, as your sugar level comes down, we'll also tailor down on your medications. And who knows, you can live very free of the diabetes and hypertension. Most importantly, for our younger generation includes me, my age bracket, the age of 30 to 40, 45 and below, because we realize that these days there's a whole lot of alcohol spree now. We have a lot of teenagers, 15, 16, 17, loading up a whole lot of alcohol. Please, you can prevent diabetes, especially if you come from a family that your both parents are either diabetic or hypertensive. You have a 70% chance of also being diabetic or hypertensive, in worst cases, both of them. So you can have one shot of bitters, 10 ml cup. We call it a shot for those who call it a shot because they like to call herbal medications in shots, or for the pharmaceuticals, we call it 10 mils. There's a cup medication prescription cup called 10 ml cup. You just have 10 mils cup per day. It prevents you from, having diabetes and hypertension in the future. So I look forward to seeing you, prescribing it for your patients, and of course, living a better life. Thank you.